The ICF Training and Technical Assistance Team is welcome to honor you to this California Housing and Community Development Training Session offered through the Emergency Solutions Grant, Coronavirus Relief Consulting and Staffing Services Contract. Today's session is entitled Data-Driven Decision Making and is part of our community workshop series. My name is Chris Pitcher from ICF, and I will be hosting today's session. It is my pleasure to hand it off to our first presenter today, Chris Andrews. Chris.
Great, thank you. Thank you so much, Chris. Good morning, good afternoon, everybody. Thank you for joining. I know we've got a few folks still coming in, but today we're going to be talking about data-driven decision making. And so I am Chris Andrews. I am subcontractor to ICF, part of MDG Associates. I'm joined by my colleague Emma. If you want to say hello.
Hi everyone, my name is Emma. I work at Homebase, also subcontracting with ICF for this project. Great to be here.
So I think we're going to have a relatively small group today, which is great. I think we want to keep it as informal of a session as we can and workshop as much as we can. So we're going to pause a couple times throughout for discussion, for questions, but if you have thoughts, you have ideas, you have clarifications, please type into the chat, raise your hand. We'll either read out your question or we will we'll call on you and you can unmute and share and discuss. And really excited to be learning from all of you today. So the agenda for today, walk through why use data, kind of what are we doing with data for you to be informing programming. What are the types of data that we can be looking at? Kind of an overview primer on how to evaluate data. This is not going to be a session where we're digging into mapping or digging into Excel, but want to use it as a session where we can at least highlight what are different ways that you can look at it. We then want to ground how you can engage and use data from an equity planning perspective. And then Emma has a handful of case study examples to walk us through. And we'll end with a discussion and wrap up from there. And we're going to begin with a couple polls. We just want to know who is here with us now. So I'm going to go to poll number 1. If we can launch that poll. Okay, we'll give folks one more minute. So it looks like half of you are going to fall into the program manager admin role, and half of you are falling into the other categories. For those in the other category, please share in the chat what your role is. Just always helpful to know. And with that, let's go on to poll number 2. How you have been using data to inform your program design. If we could open up poll number 2. Kristen, I think we're still on poll number 1.
Yes, I am trying to get number 2 to open up here. Here we go.
All right, how do you all use data right now? All right, you can go ahead and share those results and end the poll. So 30 of you or so predominantly use quantitative data, and the balance using a blend of qualitative and quantitative data. If I'd love to hear in the chat, or go ahead and raise your hand as you were looking at your ESG CV funding, right, which had a goal of getting that funding out so quickly. And how much data was driving that planning for you in launching your ESG CV activities? Any thoughts on that? And I know for me, as working in the design of a couple of communities, and we really had to pivot our ESG CV activities. I think we began very quickly with a launch around sheltering related activity, and then a year or so into our ESG CV work, really had to step back and say, okay, how can we pivot? What can we do differently with our funding, with our activities? And that was when we began to look at a blend of qualitative and quantitative data to drive our decision making. But that onset of ESG CV, I think, was really just a rush to get money out the door. All right. See, PowerPoint is paused. So why do data-driven planning, right? I think data-driven planning has been a buzz phrase that we have been talking about within community development, within housing, within homelessness, for the past 5-10 years of really kind of pushing data-driven planning, and that being kind of a priority coming from HUD, and then coming into the state, into the county, into the local level. And I think it's always really helpful when we're talking about data-driven planning is to begin to think with why we're here and have a level setting of what are those benefits. And to me, these 5 bullets are, what become the most important outcomes of data-driven planning. And I think how the work of data-driven planning can build on itself and grow and become a more involved and engaged process. So being able to make more confident decisions, being able to justify why you are making the funding decisions that you are. If you are looking to shift from funding one type of activity, one type of service provider, being able to point to the data that you gathered, the data that you analyzed, and use that to inform and to drive that decision making. It becomes much easier when you're engaging with your board, when you're engaging with elected officials, when you're engaging with your community, to justify those decisions that you made. To be more proactive, right? As you are collecting data, working within the data space, you can begin to see trends, and you can look to see how can we reconcile or address those issues early on and shift and drive funding to be addressing those needs. Better engage community and partners. Being able to bring community members together, other providers, other agencies, other entities, by sharing data and being able to say, this is what we're finding, this is what we are seeing. Help us think about how we should respond to the needs that we're identifying from the needs assessment, from the market work that you're doing, and being able to pull community and partners into that planning process. So it doesn't feel like your planning is happening kind of in a black box as much, and you're able to engage the community and be much more transparent with what you are doing. Improve outcomes, right? You're able to track what you're doing. And this kind of ties into the final bullet of being able to create metrics to evaluate success. I think it can be so hard to be able to define when we do a good job, and you can use data at the program level to create those output and outcome metrics that you're striving for to evaluate success. And Emma will talk about a few of these in her case study. And I think one of the pieces that we really want to emphasize today is the importance and the power of sharing data, right? I think we talked about the engagement of community, engagement of stakeholders, engagement of partners, finding ways to share that data with similar agencies, similar entities, and also entities that might be in a parallel space, right? If you're operating a prevention program, how are you engaging with affordable housing providers? How are you engaging with tenant rights organizations and entities? How are you engaging with economic development or job training or workforce? And being able to share your data, share your findings so that you can all look at that, interpret that data differently, and think about how can you effectively kind of create a program and a structured response to those needs that you're identifying. You'll also find, and we'll talk a little bit about this, especially when you're looking at quantitative data that might be a little bit older, or qualitative data that is coming in a smaller sample size. When you're adding in more stakeholders and you're sharing that data with partners, you're better able to verify and test and confirm data outcomes. And then finally, you're able to kind of widen that network of your data-driven decision-making. You're able to bring more people into the fold with you to think about what are the most appropriate responses to a community need, and how to share that obligation or that programming need across multiple entities. I think sharing data, right, is one of those things. It's very easy to talk about and harder to do in real life, in real work, because we all are so busy trying to find that time to share data with folks and bring people together is really, really hard. And I'm wondering if anyone on the line has experiences, best practices, what's worked for you, what hasn't, in ways of sharing data. And if you do, go ahead, raise your hand, type into the chat. Or if you've had things that haven't worked, why haven't they? Why has data sharing not worked for you? All right, well, oh, sorry, Emma, go ahead.
No, I was just saying I can speak to one if no one else is.
Sure.
Just say that, I worked at a COC for about 5 or 6 years, and I think we found consistently that when we published data, there was so much context needed for people to understand it correctly, because we're just talking about something that is not super, well known. People don't understand the context really well in the wider environment. So I think, we encountered some barriers around data sharing when it came to making sure we were sharing the right information so people were able to understand us clearly. And, newspapers weren't taking the data that we published and twisting it to mean something completely different than what we intended.
Yeah, right. I think even just the terminology, right, becomes so hard to provide the context that, you can't just put a data table out there or a graph or a chart or a map without kind of all of the qualifying information that you need. Have other folks had that experience or found ways to work through that? No? Well, we will come back to that discussion too. One of the places I wanted to make sure that we spent a little bit of time talking about is types of data. I think so often when I hear data-driven planning, then my knee-jerk reaction immediately goes to quantitative data and thinking about numbers and data that I could be getting from census or the point in time, or pulling from HMIS, or pulling from other quantitative data sources, and wanting to understand, okay, well, give me a numeric output and a numeric goal. But within our work, I think quantitative data, is limited in what we're able to pull. And there's also a very serious lag, especially as we're looking at, potentially looking at point in time data, or even more so looking at US Census data, where there's a very big lag of 1, 2, 3, 4, 5 years of that data being current, and wanting to try to compare that to what are current conditions, right? If we're thinking about what is the average cost of housing, and we're wanting to use census data, what we might be looking at is data right now from 2020, 2021, which is very, very different from the market conditions in 2023, when you're looking at a diversion or a rapid rehousing program, in understanding what market conditions might be. So I think quantitative data is definitely one piece of the puzzle, but we also want to make sure that we're looking at and being able to engage with qualitative data and having discussions around experience, activities, what's working, how are people operating within a system, what are they seeing as needs at the community level, and being able to use that data. And so from that qualitative perspective, right, you can be talking to individuals with lived experience, engaging with clients, engaging with providers, engaging with community members, other stakeholders, other entities, and can do that in a number of different ways. And you recommend all of them, right? By having focus groups, having one-on-one interviews, providing surveys, providing ways to get feedback on your program, to learn and understand what is working, what is not, and what are needs that might not be addressed, that you might not be able to pull through from just looking at quantitative data points. So I know a few of you said that you use a blend of qualitative and quantitative data. And just really want to emphasize, when we think about data-driven planning, that doesn't just mean looking at numbers, being able to pull a chart or a graph or a map, but it also means gathering all that qualitative data and making sure you are incorporating that into your planning. And when we get to the slides around equity, we'll talk a little bit more about how to make sure that you are getting an appropriate and a holistic sample size and sectional for that qualitative data work. On the quantitative data side, right, this is where you could be pulling programmatic data, be that from your own dashboard, be that through HMIS, can be pulling from point in time count, can be pulling from census. If you're wanting to look at housing trend data, there are so many great resources out there where you can be pulling accurate rental market profiles. You can get data from Zillow, you can get data from Realty Track, that really give a very good housing sample. And I think that can become very, very helpful to build off of census data that might be a couple of years old, especially if you're wanting to test a hypothesis, right? I think we so often hear, gosh, the vacancy rate is 0%, there's no housing available, or all the housing is so expensive. Yes, that can be true, but I found oftentimes if you're looking at current data, you're actually able to identify there is some housing available, and there can be housing at a reasonable price that is available. And maybe you're not going about that housing search correctly, and that can give you the leverage or the encouragement or the path forward to say, okay, how do we identify where those more affordable units are, and how can we begin to engage with those landlords? From working in incredibly tight housing markets for the better part of my career, I found there often can be housing that you can find, and just how can you be looking to find that and using quantitative data to make that justification to your community, to your leadership, can be a helpful step. So what are different ways to look at data? Right, you can look at data in a number of different ways. You can look at it geographically, where you might be comparing your COC geography to the area of a service provider. You may be comparing your city to a county, your county to the state, your county to a region, or your metro area. But I think being able to couch that analysis in a geographic setting can give very helpful context to say, okay, here in our community, this is what our feeling is, and it is compared to the county or compared to the metro area, at this level, at a greater level or not. Similar comparisons can be made by population, right? Where through HMIS, through point time count data, you can get a lot of very helpful data regarding subpopulations who are within your client base, and being able to look at the subpopulation of those who are unsheltered compared to the community as a whole from data that you're pulling from census or elsewhere, and begin to make comparisons of, okay, well, of our unsheltered population, this is how our race or ethnicity data is presented, and then have a comparison of that to the region, to the city, to the county, to your geography. And then third, being able to do that over time, right? What is trending in what direction, and being able to look at data over time. How has it changed? Is it improving? Is it getting worse? Is it staying the same? Why? But I think the important thing whenever you're thinking about data is not just to be looking at that data from, here it is as a snapshot, no context. You always want to be providing a context, be it geographic, be it from a population perspective, be it from a time perspective, so that people can better understand and see those trend lines, right? To the point that Emma made a few minutes ago, when we're looking at data, we want to make sure that we are able to evaluate and compare that data to something, and so people have a benchmark to hold on to. And geography, population, or time are the three easiest benchmarks to do that with. Before we go into talking about using data to inform and promote equity, want to pause here for questions, comments, feelings that people may have. Sure. So Abby Miller asks if we can go over this sample chart here. So this is actually a combination of geographic and a temporal analysis, looking at 4 different geographies over time from 2010 through 2020 of poverty level, and how poverty had been shifting, and seeing in each of the 4 geographies the share of individuals below the poverty level, which is in the blue. It's quite different, right? This community here in the bottom left, which was the city within one of the counties, and then it's kind of a 2-county metro area. So we have the metro area, county 1, county 2, and then the city, primary city, which happened to be in county 2, had a very high share below the poverty level. And the argument that had been made was, or kind of the hypothesis that we were testing was poverty had been going up and up and up. And that was, there was nothing that could be done about that. And the providers who I was working with said, we don't think that's the case, but we need something to show to the community that there really hasn't been a change in poverty. We just, so which is not driving, the increase in poverty hasn't been what's driving an increase in demand for assistance. And they wanted to be able to look further and dive into that further. And so that was what this chart was used for, to show that change in poverty rate wasn't really shifting from 2010 through 2020. Any other questions? Emma, anything you have that you want to add?
I don't think so. This explains it. Thanks.
Okay. Give folks just one more minute to type into the chat.
Yeah, I changed my mind. I think this is just a part of the way that we talk naturally, but I think it is really helpful too to just think about, you described your hypothesis there and the way that it was meant to tell a story and to create, decisions around what to do next based off of kind of ruling out this possibility that the main contributor to these issues was poverty. And I think that's, just something that is really important to consider as well in evaluation processes. Are you looking for, explanatory or exploratory data? Is this something that you want to bring others along to, and how do you present for that context versus is it something you're trying to kind of, some data that you're trying to understand that you're getting a group of people in a room to think about and to understand more clearly? I think in this case, it's more explanatory analysis, really trying to help people to understand the value of this data and what it's telling us versus being just kind of more something we need to figure out, and we're going to dig through all the data to figure out what's going on.
Great. Thank you, Emma. Any other thoughts, comments from folks on the line? Does anybody know how a data scientist quantifies a rabies outbreak? A megabyte? All right. Thank you for indulging me. Let's move into using data to inform equity. And when we think about using data to inform equity, it begins with who is in the room, who is making the decisions. and making sure that those folks who are in the room, are open and engaged to a data-driven decision-making process. Right? So you need to ask who are the folks who are leading the program, who's implementing the program, and are they accepting and open to a diverse set of ideas and views and opinions. And I think if the answer isn't yes to that third question, that becomes where you begin of working with that individual or that group of individuals to help encourage them into more of a data-driven planning process. Because I think you really only have a handful of shots in a period of time to be integrating a data-driven planning process into your community. And if the folks who are in that leadership role or in those decision-making roles aren't open to it at the time, you're going to spend a lot of time and effort in getting stakeholders together, data gathered, working with someone to be pulling all of that information. And you need to make sure that leadership is open to that. And open to using that data to be driving their decisions. And I think more importantly, making sure that that individual is focused on how that data can make their programs more equitable and have more equitable outcomes, and identify gaps or flaws or challenges within the program. And so those questions, when you start thinking about what is the equity and access that you should be looking at, and then you can be driving with from a data perspective is the whole community or all persons able to access and engage the projects within your COC? Can they physically get to the project location? Are they welcomed in that space by staff, by the environment, by the structure? And then, what barriers are existing that might be discriminating a person, and who is being left behind? And I think being able to think about those questions as you're engaging or starting off on a data-driven planning process will help target kind of where that both quantitative and qualitative work can go from an equity planning perspective. And so that is being able to use your HMIS data, to use programmatic data, to look at who is and who is not, accessing and having positive outcomes of your program or your projects, right? Being able to evaluate subpopulation usage. Here we have this chart that we have is showing a lot, right? It's comparing an individual program, to everybody, right? It could be the COC, it could be the community, it could be the whole subpopulation, but showing, who in the program is engaging at a race level compared to the entire community, across race, across ethnicity, and across gender, and understanding why are those discrepancies there, and are those discrepancies that might be indicative of an issue or challenge within the program to be addressing. And as you're thinking about that from an outcome perspective, if clients are able to access a project, right, are the outcomes the same? Are they entering stable housing? Why or why not, right? And being able to look at that data and consider and understand where that gap might be occurring from, and then how can you address it? Is everything focused on housing and income outcomes? And what other outcome measures can you look at? Are there other intermediate outcome measures or other outcome measures that you want to make sure that you're targeting, and including as you're thinking about what metrics and outcomes you should be setting for your program? Emma, anything that you want to add? I've been thinking about that outcome and equity planning.
Yeah, I mean, I think just this is where, like, what you're pointing to, we just, start to think outside of the traditional way that we've thought of outcomes. I think, especially when it comes to a competitive grant process for, statewide grants, federal grants, we're thinking a lot of times in what we can demonstrate, based off of quantitative data and very kind of, narrow metrics, what success looks like. And I think, to what you're pointing to here, those outcomes aren't going to be able to demonstrate equity to us without having outcomes we can measure as well around client experience and other more qualitative metrics.
Great. Thoughts from anybody on the line? So the couple questions that I wanted to open up to the group. Number one, what are ways that you all identify disparities in your programs? Go ahead, enter it in the chat, raise your hand, but would love to hear what are different ways that you are identifying disparities. So surveys, absolutely. I think I love surveys. I think that at this point, people think that we're overdue surveys. I think they can be really, really helpful tools to get a quick snapshot. And when we think about a survey, it doesn't need to be 20 questions long. I think it can be 2 questions, it can be 3 questions, it can be a 1-question message that you're texting, and being able to gather that information and understand, what is working and what's not working in an individual program. Kristen, you talked about, identifying where, outcomes aren't being met, or where there are unsuccessful outcomes at an individual level or maybe at a programmatic level. But that can be a really good indicator to go and look into the program and understand why is success not happening, right? What could be done differently to ensure that that positive outcome, that positive housing or income growth opportunity isn't occurring for that client. And I would encourage you to all do that on a regular basis. That doesn't need to be one time a year. It can be quarterly. It can be, depending on your program size, more frequently to go in and look and understand what is and is not working. So ideally, you can address that immediately. Abby Miller talking about lived experience groups or committees, which is such a a valuable, if not the most valuable form of quantitative data or qualitative data, excuse me, that we can bring into a program, and being able to have a very skilled facilitator and structured facilitation to identify what those gaps are and where they're being experienced. So ideally that can be addressed.
Yeah, Abby, I'm curious if you're comfortable coming off of mute or maybe typing a little bit more in the chat about what lived experience groups and committees you've used in the past to help you identify inequities or disparities in your system. Or Yesenia, if you want to talk any more about the surveys that you described.
Sure. We just recently did a survey. One of our coworkers was doing it for school, and she had pulled she did a survey to the majority of our residents, and it was she just recently got the outcomes for that, and it was a wonderful insight into how our residents view what chat, because I'm from Chat Chico Housing Action Team. We have about 4 or 5 programs. One of our biggest programs serves over 100 persons and is permanent housing with supportive services. And it was really insightful to see how they saw their relationship with us and what we provide from them, or what they expect us to provide for them. And it helped us understand breakdowns in communications and where it starts. And I feel like communication is one of the biggest things that that can be overlooked, because a lot of times there is an assumption made that when you're speaking to one professional to another, you know each other's acronyms, like there's a common dialogue, but truly it is so subjective to the field you're in, the population you serve, your agency and their perspectives, and then grants and fundings and so much. So it's really important to make sure that even if you feel like you're repeating yourself over and over again, that you continue to do that, because not everybody has a common language. And especially with our residents too, to make sure that we're giving it to them in the most accessible, in the most accessible language possible. So it really helped in how we're shifting those conversations in-house and where they're starting and who they're coming from. A lot of that now is starting in the beginning of our intake process, rather than when they signed a lease with us and they're in housing and now it's legal, instead of just, hey, think about this before we get to the legal part.
Totally. That's such a great point. Yeah, I think that's something that we probably all encountered in our systems is, you have people turn down programs, or you'll hear people say all the time, like, oh, people aren't interested in housing. This person said they're not interested in housing. And how often is that a communication breakdown where we're not clear in what we're offering, to the point where they can have autonomy over what they're deciding, because they truly understand it, because we're just used to saying RRH to each other, or TH or PSH or whatever the acronym is, without understanding clearly, how do the residents, how do the clients see this program, and how can we help them to understand better what it offers? That's awesome.
Abby, thank you for adding to the chat. I really appreciate kind of your comment of where you're thinking about of wanting to engage an elderly group. And I think that also ties really well into question number 3 here of who might be marginalized or underrepresented communities in your area, and being open to thinking kind of broadly about and being okay asking and saying who is underrepresented, who is marginalized in this community. it can be different population groups, can be different subpopulations, that are underrepresented or are marginalized in the community. And I think, one, being able to look at data to identify who or where those might be, but also just being open to asking that question, and then thinking, how do we engage those individuals, and who can we bring to the table to make sure that you're getting that input. I love that idea. I want to keep us moving and take a little bit of time here on question number 2. Thinking about how to evaluate a smaller rural program, right? I think the majority of our COCs in California have an area or a share of their area that is rural or has a smaller population, which means that we can be looking at abnormalities in our data that may not be real, and it might just be from a higher margin of error. And what are ways to think about how you evaluate those programs? For me, I think one of the things that I begin with is always thinking, how do we blend kind of that qualitative and quantitative data and not be fully dependent on one or the other, and use them to play off of each other and try to engage multiple data sources and multiple stakeholder groups to better understand needs, to make sure I'm getting a complete picture. But would love to hear from you all of other ways that you evaluate needs within your rural or smaller program areas.
So one of our programs specifically works with families, and that case manager has about 8 families that she works with. So about 35 clients, including children. And she got very creative, and she started putting on, well, she's always put on events, but she put on events specifically for the moms of the families, and they would all come together and have lunch. And she found out if she just let everybody just talk and not have a formal setting, that it was a really, it was like an unorthodox way to start getting everybody to talk openly and feel okay with that, because they were talking with other participants in the program about it, and they were saying things that they would not have otherwise said, because there's that power dynamic when you bring in a client and case manager relationship. So when it was just persons coming together talking about their needs, they were more open and honest about what they needed and what they felt was lacking in the program or just in the community in general. So she's just continued that to going forward, because it's a benefit for the families and for her. And then, it's just community. It's really just about building community within her program.
It's great. What a great example.
I think that demonstrates the rich value of the data you can get from small programs that just aren't possible for larger programs. The region I worked in had one metropolitan area with 10 rural regions, and I went into one day and went to go talk to them about the data that I had seen and what I saw about their performance and things like that. And they just immediately shut me down. They were like, that's not reflective of what the deep knowledge that we have of our community and how we understand it. And they were able to understand in these ways that, weren't noted in HMIS, but really that they were collecting in other ways, or that they were, collecting as qualitative data. They had just that much deeper understanding because it was a smaller population they were talking about. They knew everyone experiencing homelessness very well. They knew their history, they knew them for years. It wasn't like a situation where we were talking numbers. We were really talking about individual people, and that was a real benefit, I think, of having a smaller program. Seems like similar to what you were saying with the families program that was smaller.
And I think Emma Abbey was commenting, which I think might build off too of that, what you were describing of being able to actually be in the space and understand what are the needs in that community, and what can you access, how can you get to it, how, where are transit locations if they exist, how frequently are they transit locations that somebody would feel safe being at, right? It's a very big difference saying like, oh, there's a bus stop at the edge of town, and then saying it's a bus stop I would never want to stay at. So I think being able to understand and be there is so important. Melissa, you asked a kind of a great question about evaluating community disparities and how to be comparing subpopulations. There are apparently there is a forthcoming racial equity toolkit that will be out soon from Chris, and maybe Chris will talk a little bit about that here, but there are a few different ways that you can look at it. When I'm looking at a subpopulation, I tend to look at that, let's just say it's looking at, what is the share of unsheltered non-white individuals. I would then compare that to the universe of total people who are unsheltered, and then compare that across different subpopulation groups, and then compare that to the overall share within the community. So saying, okay, well, it's 33% of the unsheltered community is non-white, but within the geography as a whole, only 15% of the population is non-white. That can be one way of doing that relative comparison, and that is fairly straightforward form of analysis. Chris, do you want to talk a little bit about what's coming in the toolkit?
Not more than I'm previewing in the chat. We are in mid-development, so I don't want to get too far ahead of myself, but we have seen the evolution of understanding racial equity data from just looking at the longitudinal systems analysis, the LSA data, whether you did that or using the COC racial equity tool. The next step that we see happening, not only nationally with HUD, but also locally with many communities, is looking at targeted universalism, where you set universal goals and you measure everyone's achievement towards them by race and ethnicity. That's as deep as I can get now because I'm still writing the rest of it. But I did put a couple links in here, and just other than that, just stay tuned. We are definitely going to create a space to have these conversations moving forward specifically around racial equity and data analysis.
Emma, before we move on to your case studies, anything you want to add here?
I think we covered it. I think this is just one, again, to call back to general COC function. One of the reasons why there, I think, hasn't been a recommendation on one prioritization tool to be used for everybody is because we do know that who's being marginalized or underrepresented in a community is so specific to your region. It's so specific to where you are. We are seeing different populations, where immigrants are, and immigrants from different countries where they're totally different environments. And I think to be able to truly understand, we do need to have a really clear understanding of our local environment, and not take, national data and extrapolate and automatically assume that that's the same marginalized or underrepresented populations in your community.
Great.
And yes, well, this will be, sorry, Chris. Well, this will be an unpopular thing. We have seen some analyses happen across the state of California where it actually proves that white folks that appear or claim to be white, or identify as white rather, actually show worse outcomes. So it's not always just a 120. There is a lot of local nuance, and I co-sign what Emma just said completely. I would argue that data is also super duper flawed because they're not reaching the pockets of folks of color, but the data they have is telling a story that is locally kind of true. So there are no universals here. It is definitely locally. You have to understand your context of your data, which I believe is what we're really getting into here. The context of your data. Data itself isn't telling you anything, but understanding the context will. So I'll leave that there.
Great. And with that, Emma, I'll turn it to you to talk about NASA.
Perfect. Thank you. So I'm going to go over a couple of case studies, and I'm going to start with NASA New York, which I know is out of state. So there are some things that may feel a little different than the local environment, but I think this is a really great example of how data was used for decision making. So the team, used HMIS data to identify where there were access gaps. I think kind of a common thing to look at in an evaluation. And they were noticing that they were seeing a significant lack of engagement from specific parts of the region, despite wide marketing efforts. They knew that they had already done kind of some of the work to increase marketing, to make sure it was accessible in other languages, make sure the language was accessible in general. But they were just noticing this difference. And one of the ways that that showed up was that there weren't many Black and Indigenous people of color, individuals outside of families accessing shelter, that they were, remaining unsheltered. And they were also seeing high rates of unsheltered moving into housing more quickly, but in general, that was also weighed towards white male individuals. And so they started to see some of these trends and really wanted to focus in on where they were seeing a lack of engagement. So they went into those communities where there weren't established relationships, there weren't a lot of people engaging, and they tried to come with some more credible messaging, understanding that there was a difference here in what kind of messaging felt important to the people in this area. So they came with peers that they had funded through a program. They had invested some dollars in that, and did some qualitative interviews to try to figure out where the barriers to access were. And it was really around kind of upstream stuff, that people were more concerned with their immediate needs than they were about housing. When outreach workers came out and said, "Do you want housing?" or whoever it was, that wasn't their first thought. Their first thought was, "I need a job," or their first thought was, "I need medical attention, I need medical care." And there was just something about this population that the housing conversation wasn't resonating with them. And so, they responded by creating long-term peer support outreach in that area. So that was a new program that came out of the needs that they identified through their data, both quantitative and qualitative. And they worked, instead of focusing on housing as the primary thing they offered bereavement support, they offered employment and job support, whatever felt most urgent to the individual. And they consistently found that when they invested in that, it was inevitable that housing became a goal for each client without needing to prescribe those goals to them. And so that was just a level of autonomy that this population specifically really needed to be engaged. And, as I think is common, they continued to monitor the success of the program. This was not too long ago, so they're continuing to work on this and just adapt it as needed, figure out, were there more common trends they were seeing in the urgent needs in that area? Is that maybe indicative that there need to be some deeper partnerships generally around, job and resource availability for that region? And they were able to use their data to start to solve for some inequities that way. Next slide. So this next one is Santa Clara County. I'm not sure if there's anyone on the call from Santa Clara, if they want to chime in as well, but Homebase worked with them on an emergency interim housing report that was pretty comprehensive. They completed 12 interviews with staff and leadership for 6 programs that were being served as interim emergency housing programs. They organized 5 focus groups of residents from the programs, and they started to highlight some gaps through this data. They really noticed that there was 8 primary gaps across the board. There were a lot to get into, but I think 3 that kind of stuck out to me were that staff roles felt unclear to residents, which I think, we just discussed in part, but, there was a lack of clarity about what services were available, what the requirements were with engaging with their case managers, and, what support they could offer. They also noticed from staff and from residents that there were frequent emergency service calls. There was just a lot of emergency management happening that they wanted to solve for. And then there were a lot of feedback from the residents, and they were interested in more community building opportunities. So they wanted to be engaged in the local community. They wanted to participate, and so they responded to those gaps by applying for funds to expand various program services. So some of the funds that they applied for were they wanted to reallocate funding and increase funding for programs to prioritize direct specialized services. So really trying to make the services that were offered as specialized as possible, that there were, SOAR coordinators doing Social Security applications and housing navigators helping with document collection and creating the set of specialized services. When it came to emergency service calls, they worked to prevent those calls by connecting residents with healthcare services sooner, which again is a specialized role, having someone who can help them get connected to mental health support, physical health support. And then finally, when the residents were interested in more community building opportunities, they looked to strengthen their and expand their volunteer infrastructure to see, this is a great way to engage volunteers. How can we kind of build out that program? And that funding is still in the works. I think they're waiting to see if they were awarded it. But, this, instead of just saying, what funding might build onto existing programs, they worked, really intensively to say, where are the gaps in our existing programs and how can we fill them with this new funding source? So yeah, were there any Santa Clarans in the house? No. Okay. Any questions on either of these first two examples?
Emma, more broadly, can you talk about ways that you have used to incentivize and engage participation in focus group from residents or people with lived experience?
Yeah, that's a great question. I think that ensuring that we understand the value of their time has been, the biggest change that we've seen in the sector in how to engage, and the biggest change in how we've engaged with focus groups and people with lived experience is making sure to compensate them appropriately, not just with a, $5 McDonald's gift card, but can we pay them for their time the same way we would pay a case manager or anybody else who was doing this work for us. And, I think a thing that a lot of us have experienced in working, on the front lines for those who have, is that people do want their voices to be heard, and especially when there's an opportunity to have their time used for their voice to be heard, but also they're being compensated appropriately for it. And so I think the main aspect is making sure that the population is correct and is the population that's representative of who you're talking about. I recently was involved in some focus groups where we struggled and we kind of ended up we were looking to get some residents of the program. But we got a lot of people who were, either newer residents or on their way out, and people who maybe couldn't speak to, being in the program for a long time. I think like someone else called out earlier, we also, had issues with having their case managers in the room or people from the program, so they didn't feel comfortable being fully honest. I think that's a really important part of getting accurate data here too. But yeah, compensation is a big part of it. Type of community building activities. That's a good question. I don't have it. I might have it pulled up here. Let me see just 1 second. Yeah. So they were looking to create a community council of residents that were elected by fellow residents to facilitate conversations and be involved in decision-making regarding the social and physical environment at the sites that would boost resident buy-in and compliance. So residents across the site would also like to see more intentionally designed group spaces so they can have multiple options for places to congregate and share in community with one another. And then finally, offering more culturally responsive and nutritious food offerings, and offering space and the ability to prepare meals for oneself and their loved ones was another essential component to residents feeling belonging and holistic care.
I
And
did
the
want to, so on that last slide, what was that last bullet point? Respond to gaps by applying for funds to expand program services. So this is something that like at chat, we've had discussions about that we're kind of frustrated with. I don't know if it's because we're not looking in the right places or not, but so many grants that we've seen come through are for new programs, innovative programs, you know, unconventional programs, things like that. And it's just like where like we still need to pay for a building. When we're a nonprofit, we still need to pay for current employees from the last new program that we had. You know what I mean? It's so, and I don't know where those conversations start or, you know, things like that. That's, you know, it's a community thing. And I think at the COC level, I definitely want to bring this up at the next COC meeting that we have, that we need to voice out that we need more funds for current and existing programs, because just because we have money for 2 years and we show some numbers, we still have to continue that on. And I feel like that's what we've been struggling with a lot in our community for housing previously homeless persons, is just that continuous funding for existing programs.
Yeah, that's such a great point. And I think, you know, there's a part of this that's advocating, like you said, to people who make the decisions on funding for sure, both, you know, federal, state level. And I think what's interesting about what they did here too is that they were talking about reallocating funding to provide those more specialized services. So I think there was a part of it too where it was understanding maybe there are funding opportunities that are, you know, a year or two or something like that, not a long term, but could provide infrastructure costs that then you could, you know, reallocate another program to try to provide some supportive services that would take kind of like, it really takes an entire community getting behind a shared vision to be able to use your funding in that way, to say like everyone's willing to kind of contribute and maybe tweak their program a little differently so that we can make sure that the gaps are met instead of everyone kind of trying to serve the same need. But I think that's, again, talking with your COC as a whole about ways that you all can collaborate locally to ensure that if there are funding opportunities, you know, you're taking advantage of all of them and figuring out like, oh, does someone else have a grant that's a little more flexible, but this new grant that's not very flexible could cover part of their costs? Great, let's apply for it on their behalf and use their funds for something else. And I think that's a really, you know, there's a lot of relationship building that needs to happen first, but I think that's a great place to be at. Great, thanks. So then, yeah, I think many of us are probably familiar with Allegheny County at this point, just from they were one of the emerging alternatives to you know, VI-SBDAT for prioritization, which, you know, I won't get into too much today, but they, you know, they did identify that their coordinated entry assessment tool wasn't meeting the needs of their local population. So when they were making referrals or trying to figure out what the need was, the data they were using just wasn't quite right. And part of it was because they felt like there was just like some real issues with data collection. The questions had the potential to re-traumatize the clients, which negatively impacts clients, but also, you know, is likely to make them, you know, maybe unable to complete the questionnaire, maybe answer in ways that, you know, don't give the same clear answer that we were looking for because we anticipated a, you know, black and white answer to a very complex question. And so that just created some concerns about validity. And so they really wanted to be confident and not just kind of throw the baby out with the bathwater, but say like, let's really look at what we believe are strong indicators of, sorry, my cat is very adventurous today. What are, you know, the indicators that they cared most about, and was this assessment kind of measuring for those criteria? And so they used what's called predictive risk modeling. And, you know, before kind of moving forward on this process, they met with a large number of stakeholder groups to get input on a new process. They have released a like methodology study that goes into detail on what groups were engaged. But they just wanted to make sure that the process felt right to everybody else as well. They also had Atticus, which is a, you know, consulting organization, do an independent ethical evaluation of the new model to make sure that it made sense as they designed kind of an alternative tool. And they, sorry, I lost my train of thought. So they noticed that as they kind of did this predictive risk modeling, that the score produced by the previous tool was completely uncorrelated to any of the observed harms from which homeless services are designed to protect. And when they decided on what criteria to include in that, they decided to stay away from mortality as an indicator because they found that it was like 1.2% of outcomes or something. It was a very small percentage of the outcomes were mortality, the negative outcomes. What they were looking at in terms of harms were associated with lack of safe accommodation, included like poor mental and physical health, increased substance abuse, victimization, domestic abuse, sexual violence, and involvement with the criminal justice system. And not all of those harms had proxies in the data that they were looking at, but they were able to, just demonstrate that there wasn't any relationship there. And so they created a new tool where they started to see some relationship, which told them that they were moving in the right direction, and really assessed for the harms that they felt people could also, have autonomy to self-report on and things like that. And so they used a lot of existing data in their new tool, as opposed to trying to collect data in this kind of complicated way that created these concerns around validity. So I would encourage you to look more into that if you're interested in that model. It's very complex, but it was great work that they did. But yeah, I am curious, with these 3 examples in mind, does anyone have anything that this brought up for them of something that you've tested in your community, or is this something inspiring you to test something new? Yeah, what are some thoughts?
While we wait for folks to want to have a conversation, I do want to just raise up Melissa's request in the chat that if anyone has any successful design for implementing person with lived experience committees in their community, she would love to have your thoughts on that. There's an email in there. Melissa, you're also welcome to reach out to us. We do have some materials. I keep pointing back to the racial equity toolkit that is not out. We will have stuff in there about personal lived experience as well, and setting up committees and compensating folks with lived experience as you would any other staff. So we definitely have some guidance coming. Happy to talk you through that. But if anyone is willing to provide committee examples to Melissa, she's willing to take that.
Maybe to ask a more narrow question, has anyone, started to plan for any, maybe NOFO expansion, or, there's another round of ERF coming through, or the open right now, I guess. Has anyone started to consider, how to identify like which funds to apply for and when, anything like that?
Or any other questions that folks have, any topics? And if not, we've already had a great discussion.
Okay. I'm not hearing any conversations, so I'm going to go ahead and wrap us few minutes early. We all could use time back in our day, so I wanted to go ahead and do so. I want to say a big thank you to Emma Beers and to Chris Andrews for walking us through it today. And a thank you for attending this California Housing Community Development Community Workshop session off the Emergency Solutions Grant Coronavirus Relief Consulting and Staffing Services Contract. When you exit this session today, a survey will pop up. Please do fill it out. We look at that feedback every single week and we make adjustments and or add new sessions based on your thoughts. So please do that. And thank you for being here. Enjoy the balance of your day.